everybody, it's Dr. Jaime, and on today's video, we're going to talk about birth control or contraception. I'm going to give you just kind of a huge overview of different options that you have for birth control, because sometimes in the office, we don't have time to go through all of these individually. So I hope that you find this video useful in kind of gathering information so that you can make the best choice possible for you, but always talk to your healthcare provider. This is really just for educational purposes. So when I talk to patients about contraception, I kind of talk about three broad categories. But first, I want to talk a little bit about your fertility and how you get pregnant every month. So every single month, your pituitary gland inside your brain is basically telling your ovaries to make an egg. Approximately 14 days after your last menstrual period, an egg is released. If it doesn't get fertilized, then that triggers your next menstrual cycle. Menstrual cycles in a perfect world would be somewhere around 28 days, but it's normal for them to be anywhere usually between 26 to 35 days. The amount of bleeding that you have each day and for how many days is also very individualized depending on your genetics and also on some of your lifestyle decisions and your basic health. So when we talk about contraception needs, also knowing what your bleeding profile is like is also super important, because some birth controls are going to be good at controlling irregular periods or heavy bleeding, and some are not. So make sure you're telling your provider all the things that they need to know so that it suits you best. So every single month, essentially, you have about a 20% chance of getting pregnant if you don't have any birth control. That means having regular, unprotected intercourse. After about a year, most healthy couples or individuals, about 85% would become pregnant with regular, unprotected intercourse after about a year. The first kind of group of birth controls that I like to talk about are non-hormonal birth controls. So the first one that most people think about is male condoms. I don't have any visuals to show you for that, but the success rate with male condom use is approximately 85% at protecting against pregnancy. There are other barrier methods in addition to male condoms. There are female condoms, and there's also something called a diaphragm. The success rates with diaphragms are usually somewhere between 71 to 88%, and sometimes those methods can also be combined with things like spermicidal gels. There's also something called withdrawal method, where the ejaculate is not placed inside the vagina. The success with that is approximately 78%. The last one, and probably the most popular that I see in my clinic outside of male condom use, is something called the fertility awareness method or natural family planning. There's lots of different names for it. But basically, this is when you track your menstrual cycle and you either avoid intercourse during your fertile days or you use backup methods during your fertile days, things like spermicides, male condoms, or withdrawal. These things require you to be not only very in tune with your body, but you have to track reliably. With the invention of smartphones, it's become a lot easier for patients to track on an app and for the app and artificial intelligence to let us know when we're in our fertile period. Patients will track things like basal body temperature, cervical mucus, and they'll just be really in tune with other signs and symptoms going on, knowing when they're in that ovulatory window. Out of all of these things that I've just described, these are really the least effective form of birth control. So across the board, they're going to have somewhere between a 70 to maybe 85% chance at preventing pregnancy. But for some patients, they really are the best method because they want to avoid the use of any hormonal birth controls. They're having very regular cycles, or for other religious, ethical, or moral reasons, they don't want any other form of birth control. The next step up when we talk about birth control is medicines that contain both estrogen and progesterone. So these come in the forms of combined oral contraceptives, like a pill that you take orally, combined vaginal rings that you place in the vagina, or with a patch. And I don't have a patch here to show you, but a patch that you essentially place on your skin. Now, these all require the user to remember to take them and to take them in the right way and at the right time. Oral contraceptive pills, there are hundreds and hundreds and hundreds of different types of pills, but they all basically contain ethinyl estradiol and some form of progestin. So these are synthetic estrogens and progestins, and there's different classes of progestins. Some of them are more what we call androgenic and some are not. I don't want you to get confused by all of this. We could have a whole video just on birth control pills, but this is actually probably my least favorite form and for a long time seemed to be the most popular. Now, I want you to understand, as a clinician, I have my own kind of implicit biases and my own personal biases. So although I want this to be educational, just understand that this video is out of my own personal and clinical experience and what I see with my patients. Birth control pills, one thing that people will not tell you about them is that they actually deplete the body of B vitamins, zinc, selenium, and magnesium. The estrogen contained in these pills is much stronger than the estrogen that your ovaries are making, which is how it basically turns off your ovaries and stops you from ovulating. So that is the way that birth control pills work. Because of the micronutrient depletions that can happen, they can come with a lot of adverse side effects, but it still might be the best option for you. So think about the pros and cons to each of these as we're kind of working through them. Like I said, there's lots of different pills. So if you try one and it doesn't work for you, you may want to try another. Another thing you need to know about these forms of birth controls is the periods that you're having with them are not real menstrual cycles. Pill manufacturers thought that women would want to feel very normal, and so they created packs of pills that had active forms, which is the blue pills in this pack, and ones called placebo pills, or ones that don't contain any medication. Typically, when you take those pills is when your period will come or when you'll start bleeding, but it's simply a withdrawal bleed based on the fact that you're stopping taking the active medication, and it's not a real period. So I want you to understand that. Like I said, these come in lots of different forms and lots of different dosages. When birth control pills first came out, they had almost 150 micrograms of ethinyl estradiol, which at that dose makes patients very nauseous and have a ton of side effects. Today's pills are much lower doses. Most of clinicians practicing these days are going to use pills that are between 10 and 35 micrograms of estrogen in them. And so talk to your doctor about which dose you're actually getting. Pills also come in a couple other forms called monophasic or triphasic, and that is basically where the manufacturer has changed the level of progestin in each week of the pills, okay? In these pill packs, it usually has the days of the week at the top and a pack of stickers in there that you can place and replace the words here at the top for the day that you're actually starting taking the pill. Talk to your doctor about what day you should start taking your contraceptive pills and when they will actually be effective at preventing pregnancy. That's going to be different for each patient depending if they're coming off another form of birth control or if you're a new pill user. Birth control pills are about 91% effective at preventing pregnancy. So we do see pregnancies occur when patients are on oral contraceptives, but they're still more effective than some of those other barrier and withdrawal methods. In addition to birth control pills, there is two types of vaginal rings now that are inserted into the vagina, and they're left there for varying amounts of time. This particular ring, I'm not going to really go into a lot of brand names on this. So with this particular vaginal ring, you simply bend it in half and you insert it into the vagina. So you're going to have to be willing and able to insert it yourself and remove it. You can see that the ring is placed in the vagina. It should fit comfortably. You shouldn't be able to feel it. The vaginal ring this particular one stays in place for 3 weeks, and then you remove it, replace it with a new one, or you remove it and have a period. So you'll have to insert one finger into the vagina, hook the ring, and pull it out. It can also be removed for intercourse and replaced within a couple of hours. But once again, you can set reminders on your phone for this one. There's also a new vaginal ring that just came to market that's a little bit larger. You can see the size difference between these rings. And this new ring is actually good for 12 months. So this ring can be inserted and left in, and it can be removed for short periods of time. But these are great options that are a little bit more longer lasting than the traditional birth control pill, and that still give you a little bit of control over when your periods come and for how long. So those are great forms of birth control. And once again, these are still more effective than the barrier methods or withdrawal methods. The last one is the patch, which is placed weekly. The problem with the patch is, of course, if you're sweaty or if it rubs in the area, or some patients can have allergic reactions to the adhesive, but it also contains both estrogen and progesterone, which these do too. And once again, that patch is changed on a weekly basis. There is an upper body weight limit on the patch, so talk to your provider if you qualify for that or not. So in these class of medications, just to review, things like birth control pills, vaginal rings, and patches are about 91% effective, which are slightly more effective than your withdrawal and barrier methods. The next ones we're going to talk about are mostly long-acting reversible contraception, and these are actually your most effective forms of birth control. There is an injection called Depo-Provera, which is actually an injectable progestin. You come into your doctor's office every 3 months to get that injection, and it is actually 94% effective at preventing pregnancy. Now, this one in particular does come with some other warnings. It has been shown in studies to cause weight gain, and it also has a black box warning for your bone health. So talk to your doctor to see if that's going to be right for you. The next ones we're going to talk about are the IUDs, or the intrauterine devices. I brought 2 IUDs to today's video, and you can see that there's some differences in these 2 IUDs. The uterus is actually a pear-shaped organ with a triangular shaped cavity. So I have this little model here where you can see the size of the cavity. That's the actual size of a non-pregnant uterus, which is kind of crazy. These 2 IUDs, or intrauterine devices, are a little bit different. This one is a T-shaped copper IUD. But these IUDs essentially sit right inside the uterus just like that, and they fill that little cavity. This one is a progesterone IUD, and the progesterone IUDs come in a couple different sizes and a couple different strengths of progesterone, and are good for a differing amount of years. The copper IUD is good for 10 years, and the progesterone IUDs are good for anywhere from 3 to 6 years currently. There are some differences between these 2 IUDs. The insertion would be very similar. So let's talk about how they are similar. They're both placed into the uterine cavity with a pelvic examination. So the doctor is going to have to place a speculum into the vagina to visualize the cervix. So to place the IUD, your doctor is going to have to perform a pelvic examination. They're going to insert a speculum into the vagina to visualize the cervix. They're going to clean off the cervix with a little cold wet Q-tip or some soap, and they're going to insert this IUD. It's inside an inserter. When it gets inserted, these little arms are actually straight. So you can see how small that is. These are pretty small diameter. They get inserted up into the uterus, and then we take it out of the inserter and those little arms open. It sits right inside the cavity just like this. You shouldn't be able to feel it. You shouldn't be able to know that it's there. It should fit very comfortably. And then it has these strings that hang off the IUD. These strings hang through the cervix, and your doctor or practitioner will cut them approximately 2 centimeters in length. And those strings are only there so that we can remove it when you're ready to have it removed. IUDs, because they contain progesterone only and they don't contain estrogen, they have really more of a local effect. They thin out the lining of this uterus, and they also thicken the cervical mucus so that sperm cannot swim through them. The advantage that this progesterone IUD has over the copper IUD, let's talk about that. They're equally effective at preventing pregnancy. So IUDs are actually the most effective form of contraception. They're even more effective than getting your tubes tied. So this is the most effective birth control that I can offer in 2020. But there is a difference between the copper IUD and the progestin IUD. The copper IUD, because it does not contain hormones, the copper ions are actually cytotoxic to sperm, but it will not change your periods. So if you have very irregular periods or very heavy periods, the Paragard or the copper IUD is not going to help them, and it may make them worse actually in some patients. Also remember that copper and zinc compete in the body, so I want to make sure you're getting lots of dietary sources of zinc in your diet. Oysters would be a very good source. But with the progesterone IUDs, because they contain progesterone, they thin out this lining so much that we see about an 80% reduction in bleeding at 3 months and a 90% reduction at 6 months. So the progestin IUDs are actually an FDA-approved form of treatment for abnormal uterine bleeding. So for people that have irregular or heavy periods and want a form of birth control, this is a really great option for them. They're also completely reversible, meaning as soon as we pull this out, you can get pregnant the next month. With forms that contain both estrogen and progesterone, like pills, vaginal rings, and patches, because they turn off your entire system, sometimes it can take a couple of months for it to turn back on. So the IUD is the most effective form of birth control, and it's more than 99% effective. The next form after the IUDs that we're going to talk about that's also extremely effective at preventing pregnancy is an implantable progestin that goes inside the arm. You obviously cannot feel this through the video, but this one actually looks just like this. It's this size. It's really tiny. It's really small. The ones that we insert are actually white. They're not green, but it's literally this size. And this implant actually gets inserted underneath the skin of your arm. We put it in your non-dominant arm. So if you're right-handed, we place it in your left arm directly between the bicep and the tricep, about 8 centimeters from your elbow. You can push on it and you can feel that it's there, but nobody should be able to see it. We do numb up the area with numbing medicine before we place it, and we remove it the same way. We numb it up and take it out. But this is a great form of birth control. Now, a small subset of patients can have irregular bleeding with this one as compared to something like a progesterone IUD. But for patients that don't want to remember to take anything and don't want anything inside their uterus, this can be a really great option. This one really seems to be super popular amongst my younger patients, and that is a great form of long-acting reversible contraception. This one is also more than 99% effective, right up there with the intrauterine devices. Beyond these types of contraception, we offer things like permanent contraception. So in the female reproductive world, we can actually cut, burn, tie, put clips, or remove the fallopian tubes, depending on what type of procedure your doctor performs. And this is meant to be a permanent procedure. So this is not meant to be reversed. And so we want to make sure that patients are absolutely 100% certain that they do not desire fertility. For some patients, this is a very personal choice. And for some patients, for medical reasons, this is sometimes advised. So talk to your doctor about what procedure they might perform. Another reason to remove the fallopian tubes is we have new data showing that it decreases your lifetime risk of ovarian cancer. So sometimes patients have their fallopian tubes removed for other reasons. Once again, super effective, but nothing is 100%, absolutely nothing. And in the gynecology world, we of course have seen and heard of all sorts of crazy stories. And I'm sure somebody will leave some comment or story below based on something that I've said today. So just to review, there's basically 3 classes. The least effective form is barrier methods, fertility awareness methods, or withdrawal methods. Beyond that, we move to things like combined contraceptives that contain both estrogen and progestins. And then we move to long-acting reversible contraceptions, which are usually implantable devices or injections. And then lastly, we have permanent forms of contraception. So I hope that you guys found this super helpful. I'm sure there are things I didn't cover. So if you think I missed something, please leave your questions and comments below and I'll try to get them. Make sure you share this because there is some woman out there that wants the answers to these questions and she'll find this video super helpful. So share this with all the women in your life. Make sure you subscribe to our channel so that we can do more videos like this. Have a great day.